Hi everyone, I'm Lisa Gillespie, craniosacral therapist and restorative exercise specialist. It's been a long day today, but I really wanted to get this done while it was fresh on my mind. We're talking tonight about sitting while pregnant, or specifically how not to sit when you're pregnant. A lot of women during pregnancy experience pain in their low back area, around their tailbone area, and specifically their sacroiliac joint. The sacroiliac joint is formed where the two halves of the pelvis, so we're looking at a very skewed skeleton here. Wow. All right. So here we are, looking at the back. These are the left and right halves of the pelvis that meet together at the sacrum, and where they meet is called the sacroiliac joint. And these joints can become more mobile as the pelvis is being challenged during pregnancy and can create problems with pain and discomfort. When we sit, ideally, we are suspended on the base of the pelvis, and these two areas are called the ischial tuberosities. So ideally, we're sitting on our sit bones, and when you sit, you should be able to feel those bones. What happens is, especially for pregnant women, is there's the belly that's way out, and as the belly gets bigger, there's more tendency to lean back. And it's obviously not just pregnant women, but I'm focusing specifically on pregnant women. And when we sit back like that, we're placing more weight on the tailbone, the coccyx, as well as the sacrum, the triangle bone between the left and right halves of the pelvis. So when we're not on our sit bones and when we're instead tucked under, we're asking the sacrum and coccyx to be more weight-bearing, which they're really not designed to do. And when we're more weight-bearing on that area, we're creating more instability at the sacroiliac joint, and we're more vulnerable to discomfort in that area. The other piece of the puzzle is that when we sit with a tucked pelvis, so the pelvis is posteriorly tucked and we're weight-bearing on the coccyx and sacrum. When we sit like that, we can displace the sacrum and actually cause the sacrum to move forward or anteriorly a little bit. And when that happens, we're changing the length of the muscles of the pelvic floor that run from back to front. So we've got, if we look at the bottom of the pelvis here, so this would be the pelvic floor. We've got muscles of the pelvic floor that run from the coccyx and the sacrum to the pubic bone, and then we've also got muscles that run side to side as well, and these muscles make up the pelvic floor. When we are weight bearing on the sacrum, we're changing the amount of space, the sacrum and or the coccyx, we're changing the amount of space between the back of the pelvis and the front of the pelvis. We're narrowing that space. When that space is narrowed, we are putting those muscles in a shortened position. Muscles in a shortened position adapt over time. They decrease their length over time because the body's very efficient and it's not going to maintain length of a muscle that is not being used. And so those muscles tend to adapt into a short and tight position. And then when it comes time to deliver the baby, it's more difficult for those muscles to yield appropriately. So if we can focus sitting more upright so that we're suspended on our ischial tuberosities and the pelvis is nice and neutral, then we avoid weight bearing on the coccyx and the sacrum like I am right now. I am weight bearing on my coccyx and sacrum right now. So if I'm sitting forward on, and you can just play with this, rolling your pelvis back and forth. so that you can feel when you're back and when you're actually up on your sit bones, your ischial tuberosities. In that suspended position, you are giving the muscles of your pelvic floor the opportunity to have the appropriate amount of length. And for pregnant women, that's really important because you are working towards the finish line of helping that baby move out of your body. And you want to have pelvic floor muscles that are able to relax and yield and that are at a good length to be able to do the job they're designed to do. Hope that's of help, and I will see you in the next video.